Hello, my friends. We live in a most magnificent country, and one of its virtues is that it has produced the world's best medicine. We are technologically savvy and medically rich. We are also compassionate and generous and gracious. But we are being foolishly compassionate and generous and gracious by giving our world's best medicine to those who cross our 2,000-mile border with Mexico at the rate of about 10,000 per day. We have about 3 million illegal aliens coming to this country per year, and we have about 20 million illegal aliens residing here. If we want to apprehend an illegal alien at the border and take him for a medical examination, customarily, we have no idea what an illegal alien is bringing in his backpack or in his body. Then if we can examine him and we find that he does not have a disease, we may deport him. But if he does have a disease, such as a rip-roaring contagious disease, we keep him. If it bleeds, it leads. If there's a victim, we treat him. This is dangerous, this is expensive, and this is deadly. Let me review 3 ways in which we are doing this foolish generosity to our detriment. First, hospitals and emergency rooms are being degraded and are closing throughout the nation. In just the state of California, 86 hospitals have closed in the past 11 years. 86. Second, anchor babies, the infants born to illegal alien women, are causing a meteoric, a skyrocketing increase in Medicaid, in supplemental security income, and in disability income. And third, perhaps most pernicious, we have an infectious disease peril. Let's look at the first. Why are the hospitals closing? The reasons for the hospitals closing are primarily EMTALA. EMTALA is the Emergency Medical Treatment and Active Labor Act. It requires that an emergency room must treat anyone coming to it with an emergency until stabilized for release or stabilized for transfer. A woman in labor must remain until she delivers her child, and this is whether or not the individual is able to pay, whether or not insured, and whether or not legal. This is an unfunded mandate. If the hospital and the physician do not treat, they will be fined up to $50,000 per patient. But if they do treat, there is no payment. Ambulances and taxis from Mexico know EMTALA well and bring patients within 250 yards of an emergency room and know that the indigent patient will be treated, or for that matter, the wealthy patient will be treated. Not only does ordinary medicine come to the emergency rooms, but the results of violent crime caused by illegal aliens. Recognize that 95% of all of our outstanding homicide warrants in Los Angeles are for illegal aliens, and 66% of our fugitive felony warrants are for illegals. The 18th Street gang is, according to the LA Police Department, about 80% illegal aliens, and Mara Salvatrucha MS-13 is certainly almost all illegal aliens, the terrible gang having started in Los Angeles. 30% of all incarcerated criminals are illegal aliens, many of them in the drug trade, and many of them in gangs. Crime sanctuary cities are particularly afflicted, such as Denver, New York, Chicago, San Diego, San Francisco, LA, Miami, Austin, Houston. In any of these cities, no physician, no hospital administrator, no police officer is permitted to report an illegal alien to Homeland Security's ICE, Immigration and Customs Enforcement. This is similar to Los Angeles' Special Order 40. Now let's look at the anchor babies and the huge medical welfare benefits that they get. Anchor babies, as you know, are born in the United States on American soil, and once these little anchors are dropped, they pull the illegal alien mother, father, and siblings into permanent residency. They become instant citizens, the anchor babies do, and qualify instantly for welfare aid. And as I said, there are about 350,000 born annually, although I think that may be a slight emphasis upon the real numbers. This is because of a perversion of the 14th Amendment that states that all who are born naturalized or subject to the jurisdiction of the United States are citizens of the United States and the state wherein they reside. I would be happy to take this directly up to the Supreme Court. But recognize the medical disability payments that are skyrocketing because of these anchor babies. We no longer say that disability is purely physical, but we include mental disability, social, behavioral, mood disabilities. We now have 500,000 mentally disabled children on psychotropic drugs. Large numbers of these are illegal aliens suffering from such problems as attention deficit hyperactivity disorder, oppositional defiant disorder. So we are providing monetary incentives for bad and bizarre behavior, and on the street, it is actually called crazy money. Recognize also that alcohol and drug addiction are also considered disease and disability. And we now have close to 500,000 with that dual diagnosis. When Linda Torres was recently arrested in Bakersfield, she had over $8,000 in small bills in a paper bag. And the policeman who had arrested her assumed this was stolen money, but it was not. It was her Supplemental Security Income Disability Award for heroin.